Hey everybody, Senator Tim Kaine of Virginia here. I want to thank Mental Health America for inviting me to be part of your annual conference. I wish we could do it together in person, but I'm happy to participate virtually. You are a great group of dedicated advocates, providers, peers, community leaders, family members, all focused on the need to strengthen mental health in this country. We know so many folks who need more services for mental health, for substance use disorders, and that's what you are devoted to. The theme of this year's conference is COVID-19, mental health, and the need for equity. And obviously, it couldn't be more timely. We're in the midst of an ongoing healthcare crisis that includes significant mental health components, and each of you are grappling with that in your own ways, in your own community. My wife Ann and I in Virginia have grappled with it as well. We've both had coronavirus. 2 of our 3 children were laid off adult children were laid off their jobs for months because of coronavirus. We know 4 people who've died of coronavirus, and we can see all around us the mental health challenges that a health pandemic and an economic depression and a deep sense of unrest over racial justice. All of these things are compounding to create significant mental health needs in our community. The pandemic has made life so much more challenging for many Americans who are already suffering under significant stress. For those who are dealing with mental health treatment or treatment, say group treatment for substance use disorders, it's been harder to do that while socially distancing. So there's all kinds of needs that I see around the Commonwealth, and I know you're seeing them in your community as well. I want to tell you a story about one Virginian that had a real impact on me and that's motivating bipartisan efforts to focus on mental health needs of a critical community, our frontline healthcare responders. Dr. Lorna Breen. Dr. Lorna Breen was a physician from Charlottesville who trained and then became an emergency room physician in New York City. She was a talented and very dynamic leader, and she served on the front line of providing support to those suffering from coronavirus. She was deeply religious. She was an avid skier. She was a volunteer with senior citizens. She was a salsa dancer. She was a musician. But mostly what Lorna was and what she had dreamed of doing her entire life was to be a dedicated and compassionate doctor. Dr. Breen suffered from something that is very common among health professionals, the deep stress of interacting with patients day in, day out, helping them, worrying about them, celebrating with them, praying with them, and also mourning for them. In late 2019, she published an article with colleagues dealing with stress and burnout in a journal that was focused on work of emergency room physicians in the country. She became sick with coronavirus in March and had to be sent home from her hospital. She had been interacting with sick patients all day long and contracted the virus, was sent home and tried her best to recuperate for about 2 weeks and thought she had recuperated. She went back to work in early April, and when she went back, her sister Jennifer, who I've gotten to know, her sister Jennifer and her brother-in-law, Corey, her sister said she was confronted by an overwhelming, relentless number of incredibly sick patients. She and her colleagues worked 24/7 during the peak in New York with limited personal protection equipment, insufficient supplies, not enough beds, not enough help. Many of her colleagues were on medical furlough, and she told her sister that patients were dying in the waiting rooms and the halls. Quote, there was so much suffering, so much death. Dr. Breen told her Bible study group she was, quote, drowning right now. She told a friend that she couldn't help anyone. I just wanted to help people and I couldn't do anything. She said she had thoughts of hurting herself, and she was admitted to a psychiatric hospital and later released. But on April 26th, home in Charlottesville with her family, still grappling with when she could get back to help her patients, Dr. Breen died by suicide, leaving no note. Dr. Breen was a victim of coronavirus, even though her death is not counted among the now more than 180,000 Americans who have died succumbing to the virus. She was also a victim of something that affects our healthcare professionals. We place enormous demands upon our healers. Our society, including the medical profession itself, does not do enough to recognize the real cost that this work can inflict upon the mental health of the caregiver. It's a common practice for state medical boards and hospitals to ask doctors seeking licensing and credentialing whether they've ever been treated for depression. This heightens the barriers to asking for help when we should be making it easier to do so. Lorna's sister Jennifer attested to this. Here's what she said. And when she became so overworked and despondent that she was unable to move, do you know what she was worried about? She was worried about her job. She was worried that she would lose her medical license or be ostracized by her colleagues because she was suffering burnout due to her frontline work in the COVID-19 crisis. She was afraid to get help. Lorna's worries were not unusual. A 2019 survey of physicians by the American Medical Association showed that nearly 40% of surveyed physicians are worried about seeking mental health counseling, with another 12% indicating that would only do so in secret. And we know that even before the pandemic, healthcare professionals experience high levels of stress. More than half of the physician workforce reports suffering from burnout. Physicians are at a significantly increased risk of death by suicide. Male physicians have a suicide rate 40% higher than the general population. And for female physicians, it's 130% higher. Recent studies indicate that nearly half of healthcare providers working directly with COVID-19 patients in Italy and China are experiencing post-traumatic stress symptoms. Another recent study shows that there was a median increase of 60% in physician emotional exhaustion compared to levels experienced prior to the pandemic. Now, I've gotten to know Dr. Breen's family because they're in Charlottesville, and I'm really impressed with how hard they've worked to try to bring the healthcare needs of our healthcare providers to light and make changes in our society and in our profession so that we can take better care of our healers. I'm proud to have worked with them on legislation that honors Lorna and provides the training, resources, and support needed so we can prevent suicide of other wonderful and talented healthcare professionals during this crisis and also for years to come. On July 29, I introduced the Dr. Lorna Breen Healthcare Provider Protection Act with Senators Todd Young, Jack Reed, and Bill Cassidy. Here's what the legislation would do. It would establish grants for training healthcare professionals, students, and residents with strategies to improve their mental well-being and their job satisfaction. It would support the identification and dissemination of best practices for combating suicide and burnout. It would establish a national education and awareness campaign targeting healthcare professionals to encourage them to seek support and treatment for mental health and behavioral health concerns. It would create grants for hospitals, health systems, and other providers to use for employee education, peer support programming, and mental health and behavioral health treatment, with a priority for providers in current or former COVID-19 hotspots. And finally, it would initiate a comprehensive study on healthcare professional mental health needs, including the impact of COVID-19 on our healers, that can produce recommendations for all levels of government, state, local, federal, licensing bodies, as well as the medical professions themselves. It's my hope that we can include the legislation in the next coronavirus relief bill to ensure that we're well equipped to address the mental health impacts of the pandemic more generally. I've been meeting with mental health and substance use disorder providers and patients from across the Commonwealth to hear firsthand about the challenges that they're facing. I've also called on the Senate leadership to make strong investments in mental health and substance use disorder services in the next coronavirus relief package. Mental health is, of course, as important as physical health. In fact, we shouldn't really distinguish between them in terms of the way we treat them and provide services to combat them. We have to ensure access to affordable quality health care, and that's essential to promoting and strengthening our mental health. That's why I'll continue my fight ever since I've been in the Senate to protect the Affordable Care Act, which considers mental health and substance use disorder services to be what it is, an essential health benefit that must be covered to ensure access to this care for millions of Americans. Thanks to the Affordable Care Act, people no longer have to worry about being discriminated against for having a pre-existing condition. Americans should never have to fear that their president will work to pull health insurance out from under them at any time, but especially during a global health pandemic. Instead of tearing down the ACA, we need to build on it and ensure that even more Americans are covered and have an affordable, quality health plan. I've introduced legislation called Medicare X with Senator Michael Bennet that would establish a public plan on the ACA marketplace to offer families, individuals, and small businesses additional low-cost health insurance choices. Medicare X initially would be available on the individual marketplaces in areas where there is a shortage of insurers or higher healthcare costs due to reduced competition, including and probably most especially in rural communities. My goal is to generate access, greater access for all Americans, more quality healthcare coverage options, and also lower costs. As far as we've come, we've still got an awful long way to go, and this pandemic has exposed that. It's laid bare our inherent human vulnerability when it comes to healthcare and how closely tied together our health and economic security can be. The pandemic has also laid bare deep inequities that already existed in our healthcare system, but have made those inequities, especially for people of color or folks who live in communities, rural communities, for example, with fewer providers. Those inequities are more vivid today than they've ever been, more palpable, and they need to call that vivid sense of inequity and injustice in the healthcare system needs to call on a committed response by all of our policy providers. Of course, our communities of color especially have long understood this fact, but now it's plain for all to see. The pandemic continues to take a disproportionate toll on people of color, due in significant part to institutionalized racism dating back generations and centuries. For this and so many other reasons, your advocacy during this difficult time couldn't be more important. Thanks for what you do to support mental health to ensure people can access the services that they so need. I look forward to working with you as a member of the Senate, but particularly the Health, Education, Labor, and Pension Committee, to help provide the services and resources that families and communities need to navigate this crisis and get better, build better, so that we can thrive in our health for years to come. You're an integral part of that. Your work is very, very important, but it's never been more important than right now. And I appreciate the chance to come and just share words with you, especially share my thanks and my encouragement for the important work you do. I hope the rest of the conference goes very, very well. Thanks so much.